Hello, everybody. My name is Dr. Michael Altman. I'm your clinical advisor, and in this session, I'm going to be discussing your clinical rotations. Okay, so your clinical hours start midway through your degree. Please log into Contact Manager and check your student portal. Let me know, have a look at your schedule, and let me know if you need to make any changes. If you can't find a site, but you've completed all your other courses, one of the things that we might be able to do if you've run out of the other general education courses is a scheduled gap. But my goal with this PowerPoint presentation is to get you to the point where you're ready to begin your clinical rotations during your preceptorship and also discuss your externship. So we have prerequisites to doing the clinical rotations, but we also have the general education classes. So the prerequisites are the introduction to healthcare, anatomy and physiology with terminology and disease process, pharmacology, medical law and ethics. In the medical law and ethics course, this is where you're going to get the clinical packet. Medical office procedures and insurance, and then the computerized medical office. Lastly, for the last prerequisite for doing your clinical preceptorship is clinical lecture. Now, the reason why it's highlighted is because you don't really have any you don't really have any hours to do during clinical lecture, but it's getting you ready to do your clinical rotations. General education classes that are not prerequisites, you have your behavioral or social sciences, communications, computers, English, humanities, fine arts, mathematics, and also other fine arts. So basically, if we've done all the prerequisites, but you still can't find a clinical site, even though you've called, but you still have some of the general education classes, we can put those in order to give you some time to get your clinical site. So for your clinical classes, you're going to have, for clinical procedures, you have 40 hours, so it's 10 hours per week. So it's 10 hours per week for both clinical procedures and laboratory procedures. So it's 10 hours per week for 8 weeks. After that, you do your externship, which is 40 hours per week for 4 weeks, so it's 160 hours total. So that works out to a total of 240 hours for the entire clinical experience. Just as a note, you cannot forward the hours. So let's say you complete 40, more than 40 hours for clinical procedures, it will not roll over for the med lab procedures. So again, required hours, 10 hours per week for the first 8 weeks. After that, 40 hours per week for the next 4 weeks during your internship. So at the beginning, the 10 hours per week for 8 weeks. So 10 hours per week for 8 weeks, that's your clinical procedures and also your lab procedures. And then the 40 hours per week for 4 weeks, that's your externship. So locations for clinical sites. Where exactly should you be looking? Basically, it all has to do with what your schedule is and what your schedule allows. Let's say you work during the day, let's say until 4 p.m. Obviously, doctor's offices is not your best bet. In that case, urgent care centers would be better suited for you. So it all depends on what exactly your schedule allows. So if you're available during the day, you're looking more towards doctor's offices. If your availability is more during the evening, try to angle your search to urgent care centers. You also have to ask yourself realistically, what's your transportation like? Do you have access to reliable transportation? Do you have a car? Or are you using the bus? If you're using the bus, you want to find stuff that's more along the bus route. If you do have access to a car, you have to figure out what geographic range you're willing to drive, and then look in that specific area. So the skills that you're going to be doing during clinical procedures, you have to find a site that's going to allow you to do 70% of those skills. So if we're talking about temperature, pulse, respiration, height, weight, blood pressure, EKG, bandaging, eye testing, positioning and draping, disinfection, etc., etc. So if you have a look at this list, your main goal is to find a clinical site that's going to allow you to do 70% of these skills. For your lab procedures, again, 70% of the skills. Let's say that where you're doing your clinical site doesn't have access, doesn't do blood draws. You might be able to set up a site, let's say, or you do your those skills with either LabCorp, or you could do them, let's say, on a dummy arm for your venipuncture or your subcutaneous or intramuscular injections. Okay, so you can do those on like a dummy arm. It just has to be observed by their medical assistant or an RN. And then to your externship, is basically anything that they need assistance for, both in the medical setting, but also in the front office setting. So whatever the clinical site needs, basically that's your job. So think quality, treat it like a job, show up, do your best. So how do you secure a site? Okay, only reach out to offices that are feasible for you. Check with your own primary care physician or family doctor. If you have a family friend who's a physician, check with them. Ask people that you know in the medical community. Some of you do work at doctor's offices. Ask your own doctor. I actually have one student who, in my clinical procedures course, who's actually doing her clinical procedures course. She's actually doing her preceptorship at the same office. She's, just not on the clock getting paid for those hours. She's doing her clinical rotations during those hours. If you don't have any access to that, use online searches to make a list like WebMD or Google to make a list. And again, just keep an eye out for, the area that you're figuring, the area that you're willing to drive, as well. If you don't have access to a car, your transportation, if you take the bus, if it's along the bus route, or do it according to your schedule. Like I was saying before, if you're only available during the morning, if you're working during the day, then obviously during the day is not going to be feasible for you. You want something that's open up in the evening, so that would be urgent care centers. Likewise, if you work during the weekend, if you work in the evenings, then something during the day like a doctor's office is more for you. Don't wait to hear back from one office before calling the next. Make a list and figure out, name of the office, phone number, and then set your contact, call them up. I'm gonna send out a script as well. If you want the script, please email me. But basically, hey, my name's Michael Altman. I'm a medical assisting student for Kaz University. Is the office manager there? Get the name of the office manager and write their name down. Leave a message for them if they don't connect you. If you're asking, well, what is this regarding? Well, I'm a medical assisting student with Kaz University, and I'm going to be doing my preceptorship. I have to do about 10 hours per week. I'd like to talk to the office manager to discuss more on this. Once they connect you with the office manager, you tell her basically the exact same spiel. And you can list out some of the skills that you have to perform. If they do need additional information, send them my way. If they're saying, oh, we have to talk to an affiliate from the school, again, send them to me. Make your list, when you should follow up, who you talk to, if you left a message, certain details, sent out an email, etc., etc. But please don't wait to hear back from one office before calling the next. And if you're in that 2 2 to 3 months before you're starting your clinical rotations, you should be calling 10, 20 offices per day until you secure a site. So again, don't wait to hear back from one office before calling the next. Okay, so you can say something like, "Hi, my name is Michael. I'm calling from Kaiser University and was hoping to speak with the office manager regarding a student externship." Once you get the office manager, you can have a look at this script. Again, I have that on a Microsoft Word document, so just shoot me an email and I can send it out to you. My role as an advisor. Let me know if somebody has questions, somebody wants to speak to a school representative, if they want information sent to them. If somebody asks if we have an affiliation agreement first, that's what I do. I help you help set up that affiliation agreement. Please let me know once you get the interview. Okay, I can help with the resume. I can help kind of prepare you what to expect for the interview. And then please let me know as well once you've secured a site, so that way I can document it and make sure that all our I's are dotted and T's are crossed. That way you start your clinical rotations without any problems. Questions that sites might have: liability insurance. We do provide liability insurance for the site that covers you. Working with an RN, yes, you can work with a doctor, a medical assistant, or a registered nurse. If they say school needs to coordinate, give me a call. Okay, that's what I help out with. So if they do say that they need a facility agreement or the school needs to coordinate, please let me know. Again, the name, the phone number, and the contact person or office manager, and I will reach out. Resume. Let me know and let me have a look at your resume if they're requesting one. Be prepared certain things that they have to know or that you have to have before you start. You do have to have a background check, drug screen, immunization record, TB test, flu shot. Some sites might require for you to do an orientation with their site before you start your clinical rotation. Once you've secured a site, awesome work. You've done it. Okay, you have to have a clinical contract. It's basically a 4-page document that has to be signed before you start your clinical, you start your clinical procedures course. Okay, before you start your clinicals. It has to have a student signature and then the agency representative. So again, yes, you're responsible for signing that as well. Checklist of requirements, please email me and I will send this to you. Once you begin, plan your schedule. Okay? Treat it like a job. I know that most of you work. Okay? If you were to show up, let's say for your job about an hour late, what would happen to you? Well, you get fired. Exactly. Treat this like a job. This is like your job as a medical assistant in the medical field. I've actually had a couple sites saying that, the position's opened up and they're actually hiring the medical assistant once they come off their externship. Do a great job. Okay, things that require zero talent. Be on time. Okay, I recommend, traffic exists. Try to plan to arrive 10 to 15 minutes before your actual start time. Work ethic. Okay, try your hardest at everything. Be, part of me wants to say be coachable, but also always say, what else do you need me to do? Can I help with this? Put effort in. Body language. You're open to new suggestions and, always being able to do and learn new things. Energy, work ethic. Hard worker, be a hard worker. Energy. Always show that positive energy, be the positive person. Come in all nice and bubbly. Attitude, again, have a great attitude. Yeah, you know what? You might be there late. You might have, work the next day, but always show that positive attitude. Employers can see this and so can the office staff. Passion. Always remember what brought you into the medical field. Okay, show passion for your work. Be coachable. Okay, remember, this is your first time sometimes performing these skills. You might not be 100% on your first attempt. So always take constructive criticism and apply it to new situations. Do extra, go above and beyond, and then be prepared. If they're asking you to do different skills, and you don't get it correct, read up on it. Not sure what happened. Oh, so again, keep up with your classes and hours. I'm not sure if this is re-recording or recording over what I posted before, but keep up with your classes and hours. Remember, if you're doing your preceptorship, you do still have your clinical procedures or lab procedures. So please remember, do your work study for your exams or tests. Continue to do your assignments. Okay, time your clinical site. You do have to submit your timesheet each week and then your skills evaluation sheet at the end of the class. If you do have any questions, again, please reach out. That's my job to help you find a clinical site. Again, I'm not going to do the work for you, but I will assist you with obtaining that clinical site. If you do have any questions, please shoot me a text, shoot me an email, give me a call. At the bottom of the email, that's attached to this to the YouTube. When I send it out is my phone number. If you do have any questions, again, please shoot me an email or give me a call.